So I just want to say thank you. I just want to say thank you to all of you who have taken the time to join this very important conversation. All right. So we are going to go ahead and get started. All right. So we're coming together tonight to have a very important conversation about breast cancer awareness. And the title of this chat is a chat with the advocates, because we do have advocates here with us tonight who are going to give us a wealth of information in regards to breast cancer awareness. They're going to tell us a little bit about their experiences. They're also going to tell us some important information that we need to know. So this is a follow-up conversation on their experience on Capitol Hill regarding breast cancer policy issues. And our special guests tonight are Lori Lee, Don Musi, and Leona Madison. And if I mispronounce anyone's name, when you introduce yourselves, feel free to correct that. I think it's so important that we get names right. So please feel free to do that. All right, so we are moving into what is your why? What is your why? And let's start with Dawn, if you would introduce yourself and just tell us your why.
Oh gosh, I have to go first. Okay. Thank you for doing this, by the way, ladies. So why I became interested in the Komen advocacy. Obviously, my mother, not obviously, but my mother passed away with breast cancer in 2009. She was very young. I mean, she was young to die. I'm an only child, and so long story, I had my first lumpectomy in 2001. This was even before she was diagnosed, and then she passed pretty quickly after she was diagnosed. It's never fun to watch anybody go through any type of cancer, so I think it's just kind of something that I'm pretty passionate about now. I'm also in the health field, so I think that it's important for me to be an advocate for my patients as well. So this just kind of spills over, if I have to go talk to a doctor about any of my patients, or if I need to like make that extra phone call just to get my patients best care, I'm going to do that as well. So I just feel like this fits. Oh, and my name is Moochie, but it's my married name, so don't worry about it.
Okay, thank you so much, Don, for sharing your why. And that's very interesting. One thing I can definitely relate, my mother passed away from breast cancer as well. So it's definitely an important issue that we need to make as many people aware about. Indeed. Leona?
Yes, good evening, and thank you for allowing me to participate in this program tonight on the topic of breast cancer. I am a 11-year breast cancer survivor. In May of 2012, I was diagnosed early stage of breast cancer, and thankfully I found it myself doing self-examination. I received all my treatment from Fort Belvoir Institution. I went through surgery, chemotherapy, as well as radiation. While being a patient there, I was introduced to the Susan G. Komen organization. We had speakers. They gave us beautiful Mary Kay makeup and just wonderful gifts. And then after that, we also had 5K. We had several 5Ks. I've always been a part of Susan G. Komen because I believe that it's a movement to help other women. At the time before I was diagnosed, I was also ministering and supporting other women in the community. And so I felt that after I went through my treatment, I want to continue that and to continue to participate in the Susan G. Komen with the Susan G. Komen organization. And so that is my why of why I'm still a part of, this is my second term as a advocate ambassador. And I'm enjoying the journey with other women who have also been impacted by this disease.
Thank you so much, Leona, for sharing your story. And I'm happy to hear that you caught it early and that you are a survivor. That's wonderful. And the next person, is it Beverly? Angela? Lori.
Yes.
How can I forget?
Right.
We've been planning together, so how can I forget? You are definitely on this panel. My apologies. That's my
No
fault.
worries. No worries.
That's my fault.
No
You're
worries.
wearing several hats today, and
Yes.
that's my fault.
Mm.
So Lori, tell us your why.
So my why is the reason why I became a Susan G. Komen Advocacy Ambassador is to honor my mom, our mother, Mrs. Patricia Lee. She passed away in March of 2018 from metastatic breast cancer. I always had a passion for healthcare and eating right, active lifestyle. So with being an advocate is kind of in two parts. I want to honor her and fulfill my passion as a healthcare and eating right and having a healthy lifestyle. So that was my why. That's my why.
Thank you so much for sharing your story. And I definitely have to mention the Hope Lodge. That's a part of Winn-Dixie in Gainesville, Florida. That's a place where my mom and my dad were there during her treatments, and they didn't have to worry about food, any of that. They were definitely stood in and really helped a lot of people. So there are Hope Lodges throughout the United States, and that's definitely a resource and a place where people who are going through treatments can go and be there for their treatments. Okay. All right. So breast cancer should be a national priority. Absolutely. It doesn't just affect women, it affects men. And I remember being in middle school and high school, and one of my classmates had breast cancer. So and she was about 14, 15 years old. So we really should definitely be educating our youth about breast cancer as well, because it's not just something that you wait and you can get in your 30s, your 40s, or your 50s. This can definitely happen when you're a teenager. All right. Policy issues encourage members of Congress. And I see here that it says increase federal funding of breast cancer research and safety net programs in fiscal year 2024, and to preserve the National Breast Cancer and Cervical Cancer Early Detection Program. You can do that by increasing funding by at least $230 million in the fiscal year of 24, and also to make biomedical research a national priority by funding the National Institutes of Health at $50,492 billion in fiscal year 2024. Wow. That's amazing. The National Institute of Health. Did you know that the National Institutes of Health has played a significant role in prevention, detection, and treatment advancement, while also delivering scientific breakthroughs for breast cancer? Wow, that's amazing. So we have people on the job that are working every day to help us to find a cure and better treatments for breast cancer.
Leona, wait, go back to the slide. Leona, don't you have a little story? Isn't that where you were for your treatments at the National Institute of Health?
No, I was for treatment was for Belleville, but for the National Institution of Health is where I took the genetic testing.
That's
And
right.
that's why genetic testing is so important, especially when we're impacted with the disease. And as a result, my daughter also had her genetic testing, but not at NIH.
So it's really
And,
important stuff. Like,
Yes, it's very
important.
important because you want to be concerned about those that, those that in your family and the family history for more, treatment and detection.
Right.
And for those who may be watching, and for those of us who may not know about genetic testing, what does it entail and why is it important that we do this? How do we do it? Where do we go for genetic testing?
Well, it was recommended by my oncologist that I go to the NIH to have genetic testing because I have a daughter. And so they want to make sure that she wouldn't be impacted by the disease. So as your oncologist, and I had a wonderful medical team, I would say at Fort Belvoir, an oncologist that had recommended that I do everything that I could to be sure that we would catch it early if it turned out to be a case for her case. So I encouraged her, and she's she's actually a doctor. And so she's also a medical health expert. So she just recently got her results and everything is clear.
I did my testing similarly when my mom was diagnosed. My gynecologist recommended it. And she actually, at the time, there's a lab in Utah that they sent everything to. And my insurance didn't cover it, but the lab in Utah, I don't know their name, I'm sorry, but they actually waived the fees because if you have a family member that's actively getting treated for cancer and you do the genetic testing, they were waiving the fees. So a lot of insurances don't necessarily cover it right now, but you might still check with the labs because it's literally just like a swab or a spit test, and then they'll tell you. And so the lab had already, like, the gynecologist had ordered it, just like a blood test, but it came in like a kit. And then the lab had sent me a letter saying, like, your insurance won't cover this. Here's how much we charge. However, we're going to waive the fees. So just FYI.
Okay, well, that was a little different than mine because I had actually went, and it was during COVID, I actually went to NIH and had blood work and everything right there. And then I waited for like, I guess 3 weeks to a month for them to get the results back. And I went over the results with the staff at NIH. It was like an hour and a half. It was about an hour and a half interview I had with her. My daughter's clear? Yes.
So was I so far. But I do know, because this was like 2008-ish, they contacted me in 2018 and asked me to update my testing, but I haven't done it yet.
Okay.
Because I think there's more stuff that they can test for now. I think they have more technology. I don't know. I can find out more.
Probably.
So I think it's safe to say that one thing that we need to know is the importance of genetic testing, especially if you have a family member, whether it be your mom, grandmother, aunt, sister. It's important to get that genetic testing. So is it safe to say that if you don't have a diagnosis, or say, for instance, you may not have a direct family member who has breast cancer, is it safe to say that when you go to your gynecologist or you're getting your annual exams, that you should possibly ask about genetic testings? That way you would know. Is that safe to say?
Yeah, I think your primary care would also know. Because like my husband just went to his primary care and they sent him home with a list of blood work, like Leona was saying, about different tests for like diseases. It wasn't necessarily cancer, but it was a whole list of tests he could do. So I think if you just ask about the genetic testing, they'll have information.
Yes, and I
Wow.
think you have to be your own advocate and ask, for those testing, because they're not going to volunteer the information, because actually I was the only one in my family with breast cancer. My mother had lung cancer and our aunt had cervical cancers, and so because I had the traditional type of breast cancer treatment, that's why it was also recommended that I had the genetic testing and that my daughter had it as well.
I like
You
what
have to
you
ask
said.
questions. You have to ask questions. You have to ask your providers questions, because they don't, they're busy with a whole lot of things, but we have to overcome that fear of not asking questions about our bodies.
Yeah. And if you make them stay in the room for 20 more seconds, that's fine. Like they can answer a couple more questions.
Right. Because they have a lot to do.
Yeah.
Mhm. And I like what you said when you said, be your own advocate, because that's important. And sometimes when and it happens with me sometimes, I'll be afraid of, what the report will be or what will be said. But it's like you said, be your own advocate. You have to make it a responsibility to ask these important questions. So that's a really
Exactly.
great point.
And I think sometimes it's good to take a friend with you or someone with you, because you're fearful. You don't know what's going to be said, but at least you will have your friend who can ask the questions, about you. So it's also important not to walk on this journey by yourself, but to know that there's support out there, and takes, because my daughter had printed like 100 questions for me to ask, the physician. And because I had already been supporting and going with other women to their appointments and stuff, I kind of knew most of the stuff, So once the provider find out that you really a good advocate for yourself, then I think they take a better initiative to sharing information with you, additional information.
Mhm.
I love it when my patients ask questions because I feel like they're more invested in their care.
Mhm.
So I feel like I'm not
Exactly.
just like talking to a wall. Sometimes I'll say like, and I always try to ask my patients at the end of every treatment, like, hey, do you have any questions for me? But not
Mhm.
always. And I think it's a really good point to have somebody with you because there's so much information coming at you that
Right.
you might not be processing it, especially if you've just found out you've gotten a diagnosis that's scary.
Exactly. Exactly.
Yeah, really important. Good stuff.
Yeah, that's so important. I'm glad that we're having this conversation and we're touching these points, especially with being your own advocate, asking the importance of asking questions. And I really like that, you all are pointing out that this is something that's a responsibility that you have to do to promote your health. And I especially like that you mentioned a great tip to bring someone with you, whether it's a
Mhm.
family member, friend, your spouse, your daughter or your son. I
Mhm.
think that's great. I think that's really important. And sometimes I think it helps to have that arm of support because, you're scared, you're afraid, like you all said. And sometimes people keep things to themselves, their health.
Yeah.
And, they don't want to share it. They don't want to, and I think it's great that you pointed out to have someone with you so that you're not going through this alone.
Definitely.
Mhm. All right. Policy issues encourage lawmakers. Okay. I feel like this is going to be a good conversation. It says help improve access to potentially life-saving diagnostic and supplemental imaging. And to co-sponsor the diagnostic and supplemental imaging bill, which will eliminate financial barriers to medically necessary diagnostic and supplemental imaging. Do you have anything to add to policy. Like, let's talk about policy in breast cancer awareness. What do we need
Yes,
to know?
I'm sorry. Yeah, so so I attended the Florida Forum back in March, and this bill specifically was our target. So we went around to at least 25 House, Senate, and Representatives offices, and we encouraged them to co-sponsor this bill. With this bill, it pretty much eliminates the financial barriers, like, like it says. I have a testimony with this. Back in November, my primary doctor, she advised me to get a mammogram screening. And because of my family, my mother had breast cancer. So, I did and got it done. And the results came back. They said they saw something in my right breast. Okay, so I was nervous, I was scared, I was praying, all of that, because I was worried.
Yeah.
I was thinking about, my mom and what she went through, as she battled, metastatic breast cancer. So they said, hey, you need to go get a follow-up done. So I asked them, I was like, well, how much, does it cost out of pocket? They told me over $300 out of pocket to get the diagnostic and ultrasound done. So I waited, to get it done, because that's a whole lot of money. That's to be honest, that's a bill, that's a deal. So I waited until January, to get it done, and it came back clear. It came back all clean, thank God. But to think about most people, they have families, they need to take care of, and then they get a result. Hey, you have an abnormal mammogram, and most people pay $300. Some people pay in the thousands for diagnostic and supplemental imaging. So with this bill, we presented it to the House representatives, and with the meetings that I went to, 3 of them said, yes, we will co-sponsor this bill. This bill actually has been passed in Georgia. Okay. It has recently been passed in Montana. Okay. And it's making moves. So I just pray that, the whole United States, this would be eliminated, the extra cost.
And it kind of doesn't make sense to have the screening and then the diagnostic cost so much, because it's going to cost the insurance company more. Let's say it came back, there was something, because you waited even 3 months, who knows? Like, let's say it's harder and harder to treat the longer it goes, right? So it's better to find it. It just helps insurance company, medical costs, everything's going to be lower the sooner you find it. So it frustrates me that insurance companies don't see it that way, because I don't know why, but that frustrates me. So I'm glad everything came back, negative, but it's frustrating that you still have waited, and it's not like, it shouldn't be the insurance companies dictating the decisions. It should be the doctors, right? So the doctor ordered it. Like, unfortunately, it is real life. We have to make those decisions, but it's one of my pet peeves. So yeah.
Yeah,
I
and
hope.
it's just unfortunate, because just think about the people who they can't afford this type of testing, and they just walk away,
Right.
and then that's why we see the high rate of deaths, because everybody, you look at the low income, the uninsured, the underinsured, they can't afford a $300 bill like that, And so that's why we had to encourage the lawmakers that this is a very important bill, policy to push through, so that we can get these individuals taken care of. Everything's about money today. Sadly, everything is about money. And if you don't have money, sometimes you just pushed over into the corner, you know. It's
Yeah,
not
but
that everybody neglects their health, but you know, when you don't have money, what do you do? When you don't have insurance, what do you, in this country, we should not have people dying because they can't get the proper health care.
Right. The one place it shouldn't matter if you have money or not is medical care, right? Like if the
Yes,
doctor says XYZ, you just should do it. And the
exactly,
insurance companies need to just go like fall into place. That's my opinion. But
exactly.
And this is definitely a hot button issue because, like you all said, we have a lot of people who can't afford to pay this. You know, these high bills and medical expenses. And then I will just say breast cancer is something that affects everyone, right? Regardless
Yeah,
of your demographic, regardless of your income, regardless of any of that, your race, etc. It affects everyone. But the sad part is the people who can't afford to pay, it doesn't really give them much option, does it? Doesn't really give them a lot of options. So it's important that we definitely put that pressure, apply that pressure to our legislators and our lawmakers. So what I'd like to ask you, how do we make them aware? What do we need to do? Do we need to write letters? Is there a phone number that we can call? How do we make legislators aware of the issues?
you can
well,
contact your especially at the state level, like this is a state policy, right? It's not the federal side. So your representatives that you have locally, you can contact them. They all have a website. But this, as Lori was saying, like this law has passed, because this is what we talked about last year when we did the Zoom meetings for Florida. And I think it's up to like 8 or 10 now states that have passed similar legislation, because it's not okay. So I think they're recognizing it. And I think, like Lori was saying, like the more pressure and the more states that get it, like the ball will just continue to keep rolling. So, I mean, if it passed in Georgia, I know Texas it's passed, Louisiana, Illinois, like those are the states from last year. Colorado, I think, was one. Then like more and more red states, hopefully will start getting on board. This is not like, the pressure is just on the insurance companies to cover these costs so that it's the same as like a $20 copay instead of the $350 copay. Just shouldn't be like that. It's literally their policy.
definitely. And I would say first we have to vote. We have to get out and vote and know who you're voting for, know the issues that's important to them. You know, there's power in voting. You know, if you don't vote, then you don't have a voice. No vote, no power. You know, and so voting and becoming familiar and getting involved with, you know, your representatives is very important. So that's the first thing, is to vote first.
Lori, who were the 3 representatives? Do you remember where they were from?
Representative Marie Woodson, I believe she's in Orlando. Representative Lori Bierman. I forgot she's further down south. I spoke with also another representative. Her name is Representative Thompson. I actually spoke with her and she said, yeah, I'll go sponsor this. You know, I said, oh, so, you know, for her to look me dead in my face and to say, hey, yeah, you know, dead in my eyes and to say, hey, yeah, I'll go sponsor this, you know. So those are the 3 that I know of that we went.
All women.
Yeah, all women.
All women, wow.
But I mean, I think that's why the advocacy ambassador stuff is so important, right? Like you're there in person. When the bill comes up, they have an idea like, oh, this is really affecting people in my state. Hopefully, they will remember your story.
Yeah, absolutely. So we need to vote. We need to reach out to our legislators and let them know that this is something, because I don't know about you all. I'm not in Florida. I'm from Florida. I live in Tennessee, the state of Tennessee, Nashville, Tennessee, and it's campaign season. So right now, campaign season is happening. These are the type of questions that we need to be asking our mayoral candidates, and even during the years of election where we have people running for governor, state representatives, etc. These are the important questions that we need to be asking them and expecting an answer, a genuine, true answer from them about, because people are dying. People are dying. And not just dying, but when you go through breast cancer, and I know this based off of seeing my mom, it changes your body. It changes a lot of different things. With how you function, a lot of times a family member or a friend, they're not just going through breast cancer, you're going through breast cancer with them. So
Exactly.
It isn't just affecting the person going through it, it's affecting their spouses, their children, their siblings, their friends, people all around them. So it's definitely important to, I think, to let people know who are running and campaigning, hey, we need you to vote yes on this bill. Absolutely.
Yes, yes.
Very much.
Okay, mini lobby day 2023. Susan G. Komen Center of Public Policy Ambassadors. This is a beautiful picture, I will say, and I'll also say that thank you for doing what you do as advocates, because you stand in and you're the voice for the voiceless. And that's wonderful. So do y'all have highlights? What are some of the highlights that came out of the mini lobby day 2023?
Well, I'll go first. I had the opportunity to speak with the representatives, and they were younger people. For the Representative Abigail Stamberger and Senator Tim Kaine and Senator Mark Warner. And I was just so impressed on how these young people was on board with what we was trying to bring across. And actually these three individuals, representatives that I just spoke about, they were actually on board with supporting the funding for Susan G. Komen. And so it was like really kind of not even difficult that we had to convince them of anything. We shared our personal stories, and we met Senator Cory Booker in the hallway going for lunch. And
So jealous.
He took the picture. He took our picture and stuff like that. I mean, it was just a wonderful experience to see how open and engaged that they, everyone was on that day. And so, of course, awesome. Meeting these young ladies that I had the opportunity, the team of us, I'm not sure how many of us was there that day, but it was really just a joyful, and I have continued some relationships since our March, since our mini lobby day.
I have to say, like, Leona from Virginia, these two, what's this other lady's name? The one in pink, what was her name? These two had their spiel down like clockwork, because I got to sit in on one of the Virginia meetings, and also the guy was like super, super interested in helping, and he was all about women's rights, and even talked about like abortion rights and how he wanted to codify that, blah, blah. But like these two Virginians, they had their spiel down by the afternoon. Like it was so impressive to sit and listen to them just hit the marks on like the talking points that they wanted. So it was really, I was impressed with you ladies. So good job.
Awesome.
Okay,
Shout
maybe you
out to
move to Virginia.
Shout out to Virginia. And Lori, did you have any highlights that you wanted to share? I see you in some of these pictures.
Yeah, so I was in DC one week, and then the next week I was in Tallahassee. advocacy, fighting,
So impressive.
yeah. So I think it was just not overwhelming in a bad way, but it was just so wonderful meeting everyone from from the different states and from different cities in Florida at the Florida Forum. Miss Marie Woods and she really motivated us. We was all sitting in there and she said, yeah, we're gonna get this. We're gonna push this bill. We're gonna push this. She said, and I'm not gonna take no for an answer. I'm gonna get a yes. So I was like, oh wow. So she helped motivated us and encouraged us. And she looked at me, she's like, well, you just quiet. So, I walked up to her, shared my story. She gave me a hug. It was just so heartwarming, to see her and to see everyone all for the same purpose.
Mhm.
Yeah, I definitely, I'd done the advocacy stuff and we were all on Zoom and I'm in my room and I'm isolated. So it was definitely really nice to hang out with the other advocates. I think I'm not supposed to say that's probably my highlight, but I definitely enjoyed seeing other people passionate about this because I kind of felt like I was in a silo, but like in that lower picture, that's Leah. So she works for Komen and she's here in St. Pete in my town. So it was kind of nice to meet her because I've seen her a couple times now. So she's right here in my tiny little town. So it's not that small, but yeah, it's impressive because I was exhausted after DC, so I can't imagine doing it back-to-back weeks. So good for you.
Yeah.
Thank you. I
It's a
had
lot
so
of
much fun. I had so much fun doing it, and just to leave, and I felt so motivated just leaving and full of confidence, really. Just leaving and it's like wow, just meeting everyone and having some type of impact.
yeah, I think whoever said voice for the voiceless, like I feel like that's kind of like in DC, again, sitting with the rep from Virginia and watching these two women just boom, boom, boom. And he was like, of course. And I was like, this is great. Like,
Mhm.
what a great meeting to sit in on to see like change happening right in front of your face, right? Like he was on board, he was ready to go. So I don't remember his name though, Leona. You would know better.
Yeah,
But
I don't now I don't remember his name.
yeah, I think it is empowering because it should be. We're the ones that voted for or against these people or whatever, but they're
Right.
supposed to be our voice. So I feel like we should take advantage of this, federal and state. So
And
Absolutely, I agree.
I think if we look at it, we were also pouring into these young people, this younger generation that we had the opportunity to speak. They were representing the legislature people that we were also making it aware to them how important it is for them and their families to spread the word about breast cancer. Because like you said earlier, everybody's impacted. So it's more than just a job for them to just sit and listen to us, but also to spread the word across the community.
yes, the one was one of the Florida meetings. Lori, I think you had just left for the day. It was one of the senators from Florida. We had a female staffer and she was probably maybe 24 at best.
Mhm.
And she, the ladies from Virginia had gone through their spiel. Like I'm telling you, it's clockwork. And then she listened to it all and she said, I had no idea that young girls could even get breast
Right.
cancer. And she was
Mhm.
literally, it was the first time she'd ever heard that, any kind of
Yeah.
information. So it was quite, hopefully it was impactful and powerful for her to go back and, at least try to get her boss on board. But yeah,
Definitely.
Yeah, so it's important for young adults and youth to be in these spaces so that they can be learning about this information because they are the future.
Yeah.
And we see that she's a young staffer, no telling what she'll be doing within the next 5 years.
right.
But I bet it was great for you all to be in an environment with legislators and policymakers who actually care and who are relatable And like you said, Lori, she said, we're going to get it done. I'm not taking no for an answer. That is so inspiring.
Yeah.
To hear someone just be that passionate. And that's the people that we need, who are that passionate about making sure that things are getting better and things that are changing for the people that breast cancer is impacting.
Right.
Yes.
Knowledge is power. Absolutely. What should our communities know? What do we need to know?
Don't be scared to get tested, right? Like if you suspect anything, like you got to go through it. It's better to know.
Yeah, like Don said, don't get scared, because I know I was, and our mom encouraged us, hey, go get tested. You don't know, even though they told her it was environmental, you never know. So absolutely go get tested, the sooner the better.
Mhm. And I would say get out there and become involved into your community. So my legacy, my ministry, been in existence since 2000, but it was 2012 is when I actually introduced had a breast cancer component to support other women in the community. And we met once a month at the library. And I had speakers, nutritionists, speakers, my radiologists, my oncologists, and to kind of bring some of those medical people into the community. And it doesn't cost much if we do it at the library, and to share and have a panel so that women could come out, feel free to come out and talk and share about their fears and about their concerns, and also to listen to our stories, to know that if you take care of yourself, it's important to have a good support team. You need a good support team when you're going through breast cancer or any disease, but especially breast cancer. And only another woman can share with another woman if you have gone through the process. If you have experienced a loved one going through the process, and so I would say, spread the word through the local church. At my church at the time, I was a spiritual leader over the senior citizen ministry. I had my radiologist, oncologist come to the church, and it was about 100
No
people that
way.
came out. It was
That's
100 people that
amazing.
came
That's
out.
impressive. What a good
And I had,
doctor.
yes, and I had been in that church for over 15 years, and I didn't know that there were so many people in the church, even men, who had breast cancer, because it's always seemed like a taboo in the church. No one wants to talk about it, but now it's kind of more open, and that's how we participated in the Susan G. Komen annual walks every year, even up to this year. So they've been doing it since 2012. But yes, she came out and she spoke. The men came out in pink, and I thought they was just coming to support the program, and they shared they had breast cancer. They had breast cancer. So that's what we have to involve the community.
Yeah,
And get
that's
out
so
there.
impressive. I'm so impressed, Leona. Yeah.
Yeah, that's amazing. You taking your advocacy to the next level, doing it that
Yeah.
way. So with some of what you said, get tested, don't be afraid. Take someone with you as support. Get to know your legislators. Vote. That's another thing that was said tonight. Don't be afraid to ask questions. Ask the hard questions. And then what I'm gathering from this conversation, this chat, is that it's not just about women of a certain age or demographic. It's about youth, young kids who can get breast cancer, or Leona, like you said, young men of all ages can get breast cancer. So it isn't just a female issue, it's a human issue. Absolutely.
Yes.
It's a human issue.
I think there's, like, when we did the meetings in DC, there's some Susan G. Komen resources too. Like if you are diagnosed, some next steps, some of the help, like you were talking about, like the Hope Lodge. There. So I think
That's
the
it.
website has a lot of that information, but yeah, I think Susan G. Komen has a lot of, I mean, they're definitely an advocate out there, you know, kind of covering all facets of the disease and all stages. So
Awesome.
If
not to
So
throw the plug in.
you
you
can
can pull
text
that,
Komen, and that's capital letters here, KOMEN, to 40649. And this is to get information and resources related to breast cancer. And like you said, some tips, some things that you can do, resources that you can get. And one thing that I will point out too, and I'm sure that you all are aware on the line tonight, but I'm just speaking more to some people who may not know. I know in the state of Tennessee, and this it may also be true in the state of Florida, that there is, once you are diagnosed, self-attestation is accepted when you're going through healthcare for that. And you can get presumptive care while you're going through that treatment. If you don't have insurance, you can get presumptive care, and then you can apply to get full coverage to bring you through your treatments. I'm not sure how that varies throughout the United States. And Don, maybe you can kind of give more background about that. I mean, you with your expertise.
I don't know where Florida falls. I know one of the big issues that Komen is working on is when you get breast cancer, a lot of times you have to, like you said, apply. And there's a waiting period of 1 year right now, which is Medicare, Medicaid across the board. And they're
Oh,
trying to get rid of
wow,
that
that's a long time.
one. Right. They're trying to get rid of that 1 year waiting period. I think that will probably come back up when we go to DC in June, but I don't know.
Yeah, you're,
So
I
that's-
think you're referring to the Metastatic Breast Cancer Access to Care Act. So it kind of, they're trying to waive the waiting periods, you know, for the Medicare and SSI.
Yes.
Yeah, so they're trying to reintroduce that, you know, like you said, in June.
Which again, why would you make someone wait? Like,
Right.
right,
it doesn't
right.
make any sense. The expenses,
Right.
everything is just going to be more expensive. Like, it just doesn't make any sense.
Right.
And if
Time
you're
is
in a
essential.
position, go ahead, Leona.
I was saying time is essential. You know, if a
Yes.
woman is diagnosed, she can't sit around waiting for, you know, people to pass policies and stuff like that. You know, I'm not sure about Virginia. I'll have to research that. I know in New York, because I know some people in New York who have got access to funding, and they didn't have to wait. You know, even financial assistance. But Virginia, I really have to check into Virginia.
That's amazing. So I will say that if you are in that waiting period, ask about presumptive eligibility, because that can be a line of defense for you to get your treatments until you can, you know, get that coverage. So I would say definitely ask about presumptive eligibility for your treatments.
Another good tip.
All right, our
Yeah.
sponsors. Let's take a moment
Your
to acknowledge
sponsors.
our sponsors for the evening. We have Proficient Solutions, and they specialize in stucco, drywall, paint, interior, exterior repairs, and etc. So thank you so much, Proficient Solutions. We also have Purpose Inspired TV as a sponsor tonight. Thank you so much. And then we have Financial Key LLC. Unlock your financial freedom, which is important, financial freedom. Thank you again, Financial Key. And then we also have One Bridge Connect as a sponsor tonight, right out of Jacksonville, Florida. Thank you so much for sponsoring our chat tonight. All right. So at this time, thank you all for joining us. And I'd like to see, for those of you who are with us on the Zoom, do you have any questions for the advocates? Do you have any questions? You can place it in the chat, or you can unmute and ask your questions. Okay, no questions.
Well, thank you to each of you for advocating so fiercely in this country for a debilitating disease that's really affecting a lot of families. But I know that advocates like each of you will be responsible for really changing the narrative in this country and really making the world a better place. So I want to thank each of you. Also, I know Lori Lee and Miss Madison and Miss Mucci advocated at the Florida legislature. I'm in Tennessee as well. I think the policy or the legislative priority that you all sent to the legislature is something that we should be advocating for across this country. Do we know the Senate bill or the House bill that you all advocated for this bill, or can I get an overview? Because I really want to see if we can put this into play here in Tennessee as well. I love each of you. You all are important, and I thank you for all that you do. God bless. We'll see you on the battlefield, everybody.
Thank you.
Thank you
Thank
so
you.
much for that question.
Thank you. As far as the diagnostic supplemental imaging bill in the state of Florida, so the bill number is for the Senate side 460, and for the House side is 575. So I hope that answers your question. But yeah.
And Lori, can you repeat the House, not the House bill, but the Senate bill?
Yeah, the
Is
Senate
it
bill.
Senate Bill 460?
Yeah, Senate Bill 460 and House Bill 575.
And I really think we should that we should model the bill that you all legislated for here in Tennessee as well. And so I'm going to go and look that up tonight and see what we can do. And hopefully we'll have you all here in Tennessee, and we can go up on the Hill and start that conversation. Thank you all so much.
Thank you. Thank you.
Advocates are ready. And Lori, that was House Bill 595.
Yes, House Bill 575. I'm sorry.
575. Thank you. I'm glad
Yeah.
that I corrected that before I placed that into the chat. And this has been such a wonderful conversation, but go ahead, Don.
Sorry, I was just gonna add, when we did the Zoom last year in Florida, the 6 states, sorry, I think I misspoke, that had already passed similar legislation was Texas, Louisiana, Arkansas, Illinois, New York, and Colorado. And then at the time, Georgia, it had just passed, but the governor had not signed at that time. So that's nice to hear that Georgia did in fact put that into effect. So it's nice to see progress.
Yes, and
50
also
states.
Montana recently passed this bill as well. So it's moving
exciting.
along. It's moving along.
Yeah.
And I just have one thing to say, because before we even end, we encourage you to become an advocate along with us. If you're out there, you can come and do what we do, become a Susan G. Komen advocate. The more people, the more power, the more voices.
It's not scary at all. It's quite fun. I mean, it's like a little bit scary, but I mean, I feel
Once you
Lori
get-
will do okay.
Yeah, once you get your feet wet, you can run with it.
We're no like Team Virginia yet, but maybe so Lori, you're definitely going in June, correct?
Yes, I am definitely going in June, and I'm looking forward to it. I'm so excited.
Me
This
too.
is actually my 3rd year as being an advocate, and it has broken me out of my shell. I don't do stuff like this.
What
But
show was you in?
yeah, I was real shy, but this, I'm a voice for the voiceless. So yeah.
I didn't think you were that shy. She was
I didn't
chatting
catch
up.
no
Was it
shyness. Yeah.
Bean who's in from Jacksonville? Yeah, it was Aaron. Aaron Bean. I
Yes,
think.
yeah.
Yeah,
Aaron
the
Bean
new guy.
Yeah.
Yeah. She wasn't shy at all. Don't let her kid you.
Mm-mm, mm-mm. Camouflage.
Yeah. Well, I'm excited to see you ladies. Maybe I don't know, some of these other folks on the call might join us. So
That would be nice. We're open
Well,
for
you
men
all
and
heard the
women,
charge.
men and women, for
yeah,
men
there were
and
no
women.
men.
There
I
was
think
no men.
a male in there would be
At
really
all?
important.
Ooh,
Yes,
wow.
yes,
So
no men.
men, you gotta get on it. Gotta get on it. We need you advocating with us. We need your support. Thank you everyone for attending tonight. Again, my name is Paris Lee. I'm out of Nashville, Tennessee, and I work with the National Association for the Advancement of Colored People in AACP. And this has definitely been a wonderful conversation. I know that I learned a lot of things that I did not know. You've heard the charge. Make sure that you get your testing, talk to your community, your churches, your legislators, get to know them, spread the word, visit Susan G. Komen, visit their website, reach out, find out as much as you can about resources, have this conversation with your youth, young adults, the men in your community, because it affects everyone. And let's not just leave this as a conversation. Let's leave tonight and try to move forward, to move this battle forward, because we're going to win this war. Absolutely. So thank you all for attending. Thank you so much for our advocates tonight, Don Mucci, Leona Madison, Lori Lee. Thank you for everyone who attended this chat. And everyone have a wonderful night.
Thank you.
Thank you. Thank you. Bye, ladies.